9:41 a.m. Did you hear a call over the radio regarding something that was going on in Corona?
Yes, I did.
Where were you?
I was actually just leaving my home to do a canning demonstration in the city of Riverside.
Were you in Riverside?
Yes, I was.
What did you hear over the radio?
I heard that officers were in pursuit of suspect Brandon Martin for the crimes he committed recently, and that he was in the white stolen Ford Raptor at that moment.
Okay. Now let's back up a little bit more. Before you heard that call come in on the radio, did you have any information about what happened in the city of Corona the night or the afternoon prior?
Yes, I did.
What information did you receive?
The night prior, around 7 p.m., dispatch had emailed all officers on duty and off duty, as well as sent messages through our unit's MDCs to all the officers that were working, referenced Brandon Martin being wanted for several homicides in the city, which included his name, driver's license, photograph, the stolen vehicle that he was driving at the time, and that he was armed and dangerous.
Okay. So this is the information that you had in mind on September 18th?
Yes, sir.
And then also on September 18th, you had additional information that the Ford Raptor was in pursuit?
Correct.
Were you requested to go back to the city of Corona?
I actually requested myself through the MDC, not wanting to tie up the radio for transmissions, at which time a sergeant came over the radio and approved me lights and siren to the city, to Derby. Okay, so
when you received that approval, were you in Riverside?
Yes, sir.
And then, so now you're going lights and siren to the city of Corona?
Yes.
And also known as Code 3?
Correct.
All right, so that's when you're driving pretty fast on the freeway, I assume, with lights and siren blaring to get to your point as soon as possible?
Correct.
All right. So how long did it take you to get to Corona from the city of Riverside?
I would have to estimate normal drive times roughly 20. I'm sure I cut that in half with the lights and siren.
Okay, so you were there within approximately 10 minutes?
I could only estimate that, yes.
Okay, that's fine. Were you given any specific location to go to, or were you just going to Corona and getting updates on the way?
Specific location of 858 Derby Street.
And did you in fact go to that location?
I actually did, but I arrived at 850, which is one house east of 858.
And is there a reason why you went to one house east?
Yes, looking at the map and on our NBC screen, our mobile data terminal, I could see where other units are. And to be tactically minded, I don't want to bunch up on one side where all the other cars were. So I chose to come in from the opposite side, and I noticed there was no units there.
So you're responding with Dex also in the unit, correct?
Yes.
And Dex, was he wearing that tactical harness that you testified to?
Yes.
And what were you wearing?
I was wearing a full department-issued canine uniform consisting of a police vest, outer carrier with the word police across my chest, which was readily visible. Large police on the back of my chest, or back of my back, very large letters that say police in white or gray at that time. Shoulder patches that indicated I was Corona Police Department.
And I assume that you had some sort of utility belt?
That's correct.
Okay. So now you approach, or you reach one house east of 858 Derby Street, and then you and Dex are now outside the vehicle, and what are you doing?
As I exited my vehicle, I grabbed Dex. We went up to 850 on the corner, which gave me a better view of 858, which was the target location, and that's when Officer Clary met up with me.
So Officer Clary, C-L-A-R-Y?
Yes.
So you're now on the side of 858, is that correct?
That is correct. I'm on the east side. However, I'm actually on the property of 850.
Okay. And you said that it allowed you to have a better view. Is that correct?
That is correct.
A better view of what?
A better view of, from the front, I don't want to be confusing here, the front east side towards the back. which would have been more or less the west side of the backyard.
Okay. So now that you're looking into the backyard of 858, what do you see?
I saw a pair of legs with feet pointed straight up, pair of tan pants.
And did you have an idea that that may be your suspect?
I had a pretty good idea that may be him.
And also, did you receive information that the suspect was in or around that location?
I did hear transmission that a suspect was last seen upstairs of 858 towards the rear of the house.
Okay. And going back to some of the information that you received, had you received any information about a pursuit that preceded the Derby address?
Yes.
What information did you receive?
It was limited information. I believe I came in at the end of the chase, and I knew he had crashed into another unit at some point and fled on foot into a residential area.
Okay. And did you have any idea, or were you given any information as to whether there were any prior pit maneuver attempts during that chase?
I believe I learned that information afterwards, that there were two attempts.
Okay. All right, fair enough. So at that time, you didn't have that information?
No, sir.
Okay. All right, so now you see feet and legs. What do you do?
At that point, I let the other officers know that I have visual of the suspect, and he's motionless.
Okay. And so now you have visual of the suspect. You let the other officers know, and do you or the team come up with some sort of plan as to how you're going to negotiate this apprehension?
It was almost an unstated type plan, but we did fall together, and the canine typically runs point on this type of situation when somebody is known to be violent. So I took the lead, and everybody just followed in with me, and we started moving towards the side gates.
Okay. And did you go the side of which you saw the person's legs and feet, or did you go on the other side?
It was the same side where I could view the feet.
Okay. So you said that you and Dex are basically taking point. Is that correct?
Correct.
Now, Dex is with you. How are you able to control Dex before he's deployed?
On this occasion, he was on approximately a 4-foot-long leather leash.
Okay. And so now you're taking point, which means that you and Dex are in the front. Is that correct?
Yes.
And then there are other officers behind you?
There was one on my right and two on my left.
Okay. So approximately how many total are part of this apprehension team?
At that point, there was 4 officers and 1 canine.
So Dex is, I assume, in front of you with that 4-foot leash?
Yes.
Now, is Dex barking at this point?
No.
And that's part of the training for a canine, is that correct?
That is, I'm very fortunate to have a dog that's under control and quiet.
Okay, because if the dog is barking, is it difficult for you to talk to the suspect and try to get them to comply?
Correct.
All right, but at this point, Dex is not making any sounds, not barking.
Correct.
All right. So now your point, you and Dex are point. How far away are you from the suspect?
At the point we entered the side of the house through the initial wrought iron gate, roughly 25 feet.
Okay. And do you have a clear visual of the suspect?
From his shins to his feet down only at that point.
So you couldn't see from basically his waist up?
Eventually I could, but not at that moment.
Okay. So once you saw his, basically the bottom down, were you able to get into another position to have a clearer view?
Yes, I was.
Okay. And once you got into that position, approximately how far away were you from the suspect?
It could have been between 20 and 25, roughly.
Okay. But so you went to a different angle to get a better visual?
Correct.
All right. So now you are seeing the suspect. What's the suspect doing?
Suspect's laying on his back. His feet are to my left, and his head would be to my right. And his eyes are open, staring up into the sky, with his right arm concealed along the right side of his body.
And were you concerned about that?
Yes.
Why?
I could see his left hand, but I could not see what was on the right side, if he had anything in his hand or if he was laying on top of anything.
And why would that concern you?
Being the case that he's wanted for 3 murders and the fact that suspects have, in my experience, hid weapons away from us so we can't see them till the last moment, that was a great concern of mine.
Did you also consider the fact that he was on a police pursuit in a stolen vehicle?
Yes.
And what about the location? Was that at all any concern?
That was a huge concern due to a densely populated residential area. 1 block, I believe it's northeast, is an occupied school that was in session. And our main goal at that point was to subdue him so he couldn't flee and get into any other homes or get into that school.
All right, so now you see the suspect, but you don't know if that suspect is armed, is that correct?
Correct.
What are you doing at that time?
At one point, I advised that we were the Corona Police Department, yelling loudly at Brandon Martin to slowly show me his hands or he would be bitten by the police dog.
And are you the one that is making these statements to him?
I was the sole person making those statements, yes.
Okay. And you said you were doing it loudly, is that correct?
Correct.
And you were doing it in a way that was easily discernible for the suspect?
Yes.
Once you gave those, how many times did you give those commands?
1 command, 1 time.
Okay. And what command did you say?
Corona Police Department, slowly show me your hands or you're going to get bit by the police dog.
Okay. And did you receive any sort of response?
No response or movement.
When you did not receive a response, what did you do?
Deployed the canine to apprehend Brandon Martin.
Okay. Now, you said that you announced one time you're with Corona Police Department and that you have a canine. Please show me your hands or else you'll get bit. Is that correct?
Correct.
Why didn't you repeat it more and more times?
We have the option. It's on the handler's shoulders to discern whether or not you're going to give that command or that chance in this type of situation. This isn't a normal situation where it's a residential burglar. I'm not going to give the suspect in this case any more chance to formulate a plan in his head as I give him multiple commands, do this, do that, do that. If I didn't get a command or a movement or a response the very first time, and I can have a loud voice because we train this way, then I'm not going to allow him to game plan us. The dog's going to be deployed so I don't lose that window of opportunity.
And you in fact deployed Dex, is that correct?
Correct.
Now, Dex, when he was deployed, what did Dex do?
Dex bit Martin in his left lower shin area.
And did the suspect respond in any way?
He immediately sprung up to his feet.
Okay. And what did he do at that point?
He began fleeing backwards through the backyard, and as he was punching Dex multiple times with fists on his head and face.
Okay. You said that the suspect was going backwards, is that correct?
Correct.
And at the same time punching Dex in the nose and face?
Correct.
What was Dex doing? Was he just latched on, or was he biting opening and closing his mouth, biting different areas?
At that point, he was holding the bite and taking the punches.
Okay. Did that change?
That did change.
Explain that.
As he was being punched in the head, at one point, Brandon bent down and grabbed the dog in a bear hug, which he had the whole dog's body. His face would be facing the dog's tail now, with his back towards his face, and picked him up, and this body slammed his whole weight onto the dog, smashing onto the concrete.
What part of the dog hit first?
Would have been his chest area.
Chest area, okay. Did Dex respond in any way?
He did. He yelled out or scream. I want to say scream, but I don't know if dogs scream. But he yelped out in pain.
Okay. When you saw that, how did you respond?
I responded thinking, I don't know, the suspect bounced back up on his feet now. He was back up on his feet. Dex was now biting one of his inner thigh areas. He was latched on to the inner thigh. And not knowing what kind of damage the punches were doing to the dog or how much more the dog can handle, I used my rapid containment baton and two-handed strike struck him on his right shoulder collarbone area.
Okay. So going back, you said that this suspect basically used his body weight and slammed Dex down to the cement. Is that correct?
Correct.
And I heard you say Dex yelped in a fashion, and then I believe you said that after that, Dex then bit the inner thigh of the suspect. Is that correct?
That is correct, because that's right where his head would be in that position.
Okay. So Dex was still engaged in trying to contain the suspect?
Yes, he was.
All right. You said that you used a rapid containment baton?
Correct.
Is that a baton that telescopes out?
It does.
Okay. And you said that you also hit him on the right shoulder collarbone area?
Yes.
Why to that location?
Why that location?
Yes.
I felt at that point, which that's an approved location to strike, that I could probably drop him and stop the fleeing if I can get a good hit on him.
From when Dex was deployed, did you run up with Dex, or were you still back 20 to 25 feet?
Initial deployment, I'm going to stay behind my cover and concealment.
Okay.
Cover and concealment?
For your protection?
Yes, sir.
All right. Now, but once Dex was being fought with and was thrown to the ground, did you approach at that point?
Yes.
Okay. By the time you got to the suspect, I understand you said that the suspect had, previous to that, had been backing away with Dex. Is that correct?
Yes.
And do you know approximately how far in feet the suspect was able to get away from you, or let's put it a more simple way, from the point of the location where the suspect was to the point of where you approached the suspect? About how many feet is that?
It had to be every bit of 20 feet.
Okay. So basically he's fighting with Dex and moving 20 or more feet.
Correct.
When you, was it just you that approached the suspect and used the baton?
At that moment, yes.
Okay. Did other officers follow?
Yes.
Now, when you are using your baton, are you giving any other commands to the suspect?
Yeah, I told him to get on the ground.
And did he comply?
As I hit him, he complied.
Okay. And now that the suspect's on the ground, were there any other commands given by either you or anybody else?
More commands from myself, telling him to stop fighting the dog and to get on his stomach.
Okay. Was at any point were his hands in a location that you feared for your safety?
At one point, I didn't know where his left hand was. So yes.
Okay. Are the other officers, do you know, giving commands as well when they're trying to apprehend him?
I believe they were at that point, because at that point they were taken over because the subject was on the ground.
Was the suspect doing anything else in an attempt to try to flee the location?
He struggled till the very end, till the handcuffs got on. So yes, he was kicking and struggling on the ground the entire time.
Okay. And tell us about how the handcuffs were able to be applied to him.
I can't be 100%. At some point, the officers were able to get his hands from under his body and handcuff him.
Okay. Okay, so it wasn't you, it was somebody else that did it.
That's correct. It was not me.
Okay. What were you doing during the time that he was being cuffed?
My job is to make sure the officers are safe and that the dog's doing what he's supposed to do. And once the handcuffs were placed on him, the dog's removed immediately.
Okay. So before he's handcuffed, the dog's still doing whatever the dog does to try to contain the suspect.
That is correct. He'll stay on whatever body part he's on until the handcuffs come on.
Okay. And then once the handcuffs went on, what did you do to now take Dex away?
I physically removed the dog from Brandon.
Okay. And Dex complied?
Yes, he did.
Thank you.
Thank you. Were you one of the last officers to arrive at the Derby address?
I could only assume I was.
Okay. So when you got there, approximately how many units did you see?
I saw an armored car. I can't tell you how many units were there.
And I'm assuming that there was a group of officers there as well. Is that correct?
Yes.
Okay. And where were they positioned when you got there?
They were positioned mainly in front of 858 Derby.
Okay. In the driveway area there?
Yes, sir.
Okay. Did you consult with that group of officers prior to you appearing in the backyard and seeing what you saw?
As I saw what I saw, I let them know what I saw, yes.
Right, but before you had to go in the backyard, you had to look around the corner to see what you saw originally, correct?
I didn't look in the backyard, then come back. This was all from the front of the residence, looking down the side.
Okay, so you're standing at the residence. Did you go to the left or to the right to make your observation?
Well, I'm to the edge of the residence to the east, which is 850. So being on 850, I could look between 850 and 858
okay.
and view what's back there.
Okay, so you're coming, if this is the front of the house, you're coming from here and you're able to make a visual from the street, basically, from the sidewalk?
That's incorrect.
Okay. Explain it to me so I can understand.
You were just on the wrong side.
All right.
I came from, if this is 850.
I'm going to make this easy for you.
Okay.
If I can find the picture of the front of the house. Do we know where that is?
If that takes too long, I could even draw.
I've got it.
Okay.
With that one. I know which.
Is correct. Yes, this is 113. Number 113. That's the Derby house.
Yes, sir.
Look familiar?
It does.
Okay, great. With the pointer, then, can you show us where you made your, if it's either on there or where you made your initial observation?
It would be, the house 850 is going to be on this side. So
okay.
I was on this side of the residence.
Okay. And
so to the left side of the house?
Yes, sir. If you're
facing the photograph.
That's correct.
okay. So, and where were you when you made your initial observation?
Off the screen here on this side of the house.
Okay. Did you have to go actually in that walkway to make the observation, or could you make it from where were you positioned, I guess is my question.
It's hard not having the picture of the neighbor's house.
Right.
It was be on the neighbor's property at the edge of their fence line.
Okay. So did you go in the neighbor's backyard?
No, sir.
All right. Okay. So you made your initial observation, and then did you come back and reconnoiter with the group and say, this is what I saw?
No, sir.
What'd you do when you made after your initial observation?
As I made my observation, I relayed to Officer Clary, who was with me,
Right.
what I see, suspects right here. The other people knew what we were talking about, were like, come on over.
Okay.
So that's when our group, the search group, our arrest team was made.
In which side of the house did you make your, where did you head?
The same location right here. I've never crossed the house. It all happened through 2 gates right here.
Okay. So then the group of you then head down that side of the house. Is that accurate?
That is correct.
Okay. And then eventually, I'm guessing you get to the corner and you peer around and you make your second observation. Is that correct?
Yes.
All right. And from peering around the corner, about how far away was Mr. Martin?
At that point, roughly 25 feet from where we were.
So is he on the other side of the house, basically?
He's still on the same side of the residence. It's just the garage, the rear of the garage kind of cuts in and the house makes a turn.
Okay, all right. So if we're looking at the backyard of the house, was he closest to you, center of the house, or far side of the house?
Well, he was still on our side of the house, so he was still on the east side.
Okay.
But if we're looking at him, he's going to be to our right.
All right. And you look and you see him lying on concrete, correct?
Half concrete and partial grass.
All right. And I'm now at your second observation when you're back there with the other folks. You told us that you believed he was lying on his back looking up into the sky. Is that correct?
That's correct.
Now, Officer Bajines testified last week. He was with you there, correct?
At some point, he was there, yes.
Okay. Officer Bajines testified he was right behind you, just so you know. That's what he said. And I understand you weren't looking behind you, so. Officer Bajines testified that when he peered around the corner, that Mr. Martin was lying on his side and that he could not see his face. Is it your testimony that he was in fact lying on his back and staring up into the sky?
Yes.
All right. And is it your testimony you were able to see his eyes?
When I said he's staring up into the sky, it appeared. Eyes were open. Don't know what he was looking at, but eyes were open.
That's my next question. You were able to determine that the eyes were open. Is that correct?
Correct.
All right. Were you able to determine any movement in the eyes, blinking, looking around, anything like that?
I couldn't determine at that point.
And the entire time, the body does not move until the dog gets to the body. Is that correct?
From my vantage point, I could not see any movement whatsoever.
Right. I think the phrase you used was motionless, correct?
That is correct.
So he's lying on his back. Are his feet facing toward the backyard, or are they facing toward the house?
They're facing more towards the neighbor's backyard, which would be 850 next door.
Okay. Lying on his back, facing this way, and you can see his left hand, you tell us, correct?
That is correct.
But you say the right hand is where?
The entire right hand and arm are along the right side of his body.
Okay. So they're not tucked in anywhere. He's just...
I can't tell if it's tucked in. I just know it's going to be somewhere on that right side because I can't see it.
And it's not out here, and it's not up here, correct?
Correct.
Okay. So it's just... I have a picture of him laying supine, just looking up. This is what you're saying while you're making your observations. Is that accurate?
That's accurate.
One time you say, Corona Police, show us your hands or the dog will bite you, correct?
Yes.
Do you know, was he able to hear you?
I can't determine if he heard me or not. I would just think he didn't because he didn't move.
Okay. No reaction on the face?
I saw no movement whatsoever.
Didn't even turn to look to see who was talking or what was going on?
I didn't see that.
Okay. You say that one time, you get no response, and then you deploy the dog, correct?
Yes.
Physically, what do you do in order to deploy the dog?
Give him the bite command.
Okay, and what is the bite command?
FAUS.
I'm sorry?
F-A-U-S.
Oh, F-A-U-S. Okay.
Yes.
Before that, do you unhook the leash, or do you let him go with the leash on?
I don't know if I took it off or not. I can do it either way.
Okay, there's no right or wrong, it's up to you.
Correct.
Okay. You say Foss, and what does Dex do?
He has target lock, which we have to make sure. When I say target lock, he has eyes on the suspect. He runs and bites subject in the left leg.
Okay. And did he latch on to the left leg?
Yes.
What is he trained to do when he bites?
To bite and hold.
Okay, bite and hold?
Yes, sir.
Okay. And hold for how long?
As long as it takes.
Okay. How do you eventually get him to let go?
In this type of situation, I could verbally have him release, or I can go hands-on and take him off the bite.
Okay. Verbally, is there a command to release?
Yes, there is.
What's the command?
Los. Los?
Okay.
I believe that's
Dutch?
spelled many ways. It is Dutch.
All these are Dutch words, basically?
Yes, sir.
Okay. You can either say los, or physically, what do you do in order to get him to release?
We could approach him, bring his collar, his metal collar up high, which kind of cuts off some of the air right there, and
Okay.
he knows to come off, or we could grab him by his flank in the back and take him off.
Okay. By the way, when Dex is not on patrol with you, where does he live?
Are you referring to at home?
Yeah,
At home, yes.
with you.
Yes.
So when he's not working, safe to say he's the family pet?
No, sir.
Okay. So how does he interact with your family?
They're a working dog.
Yes.
When they're working, so they stay in a kennel outside the
Okay.
entire career.
All right. So they're not sitting there watching TV with you at night or anything like that?
No.
Okay. But it's your responsibility to feed him and do the water and this and that?
Yes,
Okay. Does the family partake in that as well, or just you?
they have.
Okay. So getting back to the scene, so you tell us Dex grabs on the ankle and stays there, correct?
It was a shin area, yes. It was a shin area. He mentioned ankle.
Does Dex stay on that area of the body the entire time?
At that point, he did, yes.
The entire time of this incident, does Dex stay on that part of the body?
No.
Where does Dex move?
A couple times he moved to different locations because when dogs get uncomfortable or they're getting beat up, they're going to try to get away from that at most points and bite another area and hold on.
So it's your testimony that while Dex was on the shin area, this is when he was being struck by Mr. Martin, correct?
Yes.
Okay. Now, Officer Begines testified that Dex approached the body, sniffed around 2 or 3 times, and then latched on to Mr. Martin's groin, specifically onto his penis area. Is that what you saw?
No.
Officer Begines never testified that he got the ankle. He said he went straight for the crotch, and he stayed on the crotch the entire time. And that,
Objection with Officer Begines.
thank you. Officer Begines did not testify that he latched onto the shin. He testified that he latched onto the crotch, and that while he was on the crotch, Mr. Martin was punching him. Did you see that?
That did occur.
Okay. But you're saying initially it was the ankle, correct?
Yes.
Oh, sorry.
Shin.
Initially it was the shin.
Initially it was the shin, correct.
Okay. And then eventually you're saying Dex did move into the groin area. Is that right?
Yes.
Okay. What did you do how did this end? How did Dex get off of him? Did you give the verbal command? Did you do the physical? What happened?
I physically took him off. This was a very violent but quick situation. So towards the end, Dex had slipped off of Martin's hip area, which is a hard area for a dog to keep a hold of. So he slipped off, had his clothing, and then I can't remember if the clothing actually ripped and that's how he got off, or if I just physically took him off. But either way, once he was done from the hip and the clothing, he had no further contact with Martin after that.
Okay, and do you know Was Mr. Martin handcuffed at this point?
Typically, suspects are handcuffed, and being who he is at this point, the dog would have been released after he was in handcuffs to prevent any further escapes or bites.
Right. So procedure is you leave the dog on the person until the person is under control. Is that accurate?
Yeah, until they're handcuffed, sir.
Until
Yes,
they're handcuffed. Right.
yes sir.
So he was latched on until he was cuffed behind his back, correct?
Either his clothing or his hip area, but I believe it was the clothing, yes.
And then once he's cuffed in the back, then you either give them command or you physically you physically remove him from him.
That is correct.
Thank you, that's all.
Yes, thank you. Let me show you People's 240. Zoom in to 858 here. And do you see that satellite view of 858?
Yes, I do.
All right. And you were on, as we are looking at 858, you are on the right side when you approach and you see Mr. Martin's legs. And I forgot to ask you, the person that was apprehended, do you see that person here in court?
Yes, I do.
Where is that person?
At the defense table with his hand on his face, wearing a white mask and white button-up.
Thank you. That person, when you initially saw him, can you point to approximate location you were?
I don't know if it's my old eyes or what, but it's hard to make out. This looks like the driveway. This looks like the corner of the east side. To be honest, I can't make out what this is right here.
Okay.
But it looks like grass. And this piece here is covering the cutout in the garage in the house. It would appear it would be right in this area.
Okay, to the lower right corner of the 858 label?
Yes.
All right. Now, you said that this was a quick, but it was a violent struggle. Is that correct?
That's correct.
All right. And did you actually document all the injuries that Mr. Martin had after all this was done?
Yes, I did.
And how did you document that?
On an official criminal police use of force report form.
Okay. And when you documented it, how did you know that Mr. Martin had these injuries? Did you go see him or?
I physically saw them and made note of them.
Okay. After Mr. Martin was apprehended, where did he go?
To the hospital.
Okay. And is that where you made the notations?
At the hospital and at the scene.
Okay. And so before he went to the hospital, where did he go?
Well, he was seen by AMR and Corona Fire Department out front.
Okay. And so are you making some of the notations at that time?
Yes.
All right. And some of the notations that I see in your report is that he had an abrasion on the left cheekbone area. Is that correct?
Yes.
Was that due to a bite?
No.
And do you know how that happened?
Again, I can only assume it happened from the struggle and him being handcuffed because he was face down at one point.
Let me ask you this. When you saw him initially on the ground, face up, was his left side was too, is that correct?
That is correct.
And then later on, you saw the abrasion on his left cheekbone. Is
Yes.
that correct?
Yes,
Right.
it is.
When he was laying down on the ground, did you see the abrasion at that point?
I didn't see an abrasion at that point.
Okay. So is it fair to say that the abrasion occurred sometime during the struggle,
Yes.
during the apprehension?
Yes.
All right. You also noted that there was a puncture. A puncture, is that a bite?
That would be from a dog's tooth, yes.
Okay. A puncture around the scrotum area. Is that correct?
Yes.
All right. And then what are rake marks?
Rake marks typically happen with a dog bite where the dog slips a little bit and you'll get the teeth that are behind the canines making some marks on the skin.
Okay. And those were in the left upper thigh area?
Yes.
And then there was redness or an abrasion to his left index finger, Mr. Martin's left index finger.
Correct.
So not a major injury, but something that you need to document.
Yes.
And then a inner upper left thigh area puncture, meaning a bite. Is that correct?
Correct.
Abrasion, right knee area. Again, nothing super significant, but you need to document it.
Correct.
Redness, an abrasion, right ankle area.
Yes.
And then redness, rake marks, right shin area, meaning he was bit on the right shin.
I don't know if that's from a bite or not. I would have to look at the picture again on exactly what that was.
Okay. Laceration, left shin area.
Correct.
And consistent with a bite.
Yes.
And then punctures, right shoulder area, and rake marks, also consistent with bites.
Correct.
And then redness, rake mark, left hip, waist area, consistent with being bit in that location.
Yes.
And then redness, left chest area. So again, nothing significant, but you have to document it.
Correct.
All right. So so imagine that as Mr. Martin's struggling and fighting with the dog, I believe you said on cross-examination the dog would try to get to a different location to gain compliance. Is that correct?
If the dog's feeling uncomfortable or he's being injured somehow, it's not uncommon for a dog to readjust and find another spot and stay in the fight.
Okay, so we have from your notes and what you testified to, it sounds like the dog started with the shin and then went to different areas such as the scrotum, the right shoulder, and other areas of the body.
That's correct.
Okay. And is that common for a canine to do when a suspect is fighting with the animal?
It's very common, and this was very violent, and it was changing quickly and often in a short amount of time. So the dog was staying with it, he wasn't backing down, and he wanted to do what he was trained to do, and he eventually did with our help.
Thank you.
Yes.
Nothing, thank you.
Witness excused or subject to
No objection.
recall? Excused. Thank you, sir.
Thank you, sir.
Next witness.
Yes, thank you, Your Honor. People call Dr. Schuman. If I may step out.
Yes. My name is Leticia Schuman, Leticia, last name Schuman.
Thank you, Your Honor. Good morning, Dr. Schuman.
Good morning.
Who do you work for?
I work for the Riverside County Coroner's Office.
Okay, and what's your duties with the Riverside County Coroner's Office?
I am one of the forensic pathologists.
And to be a forensic pathologist, do you have to have some education and training?
Yes.
Okay. Would you mind telling us what education you have that led up to becoming a forensic pathologist?
Okay. So first, I graduated from Baylor University with a Bachelor of Science degree in Forensic Science. And then I attended medical school at the University of Texas Health Science Center at San Antonio, where I received my medical degree. And then I did a 4-year pathology residency, which I completed.
I'm sorry, let me just stop you there. So you graduated from Baylor in Texas,
Yes.
Okay, and that was in 2003?
Yes.
Okay. And then from Baylor, you go to San Antonio School of Medicine, graduate there in 2009?
Yes.
Okay. And what's the qualification you got when you graduated from the San Antonio School of Medicine?
My medical degree, my MD.
Okay. So at that point, are you a doctor?
Yes.
Okay. Then following your education and your graduation from the School of Medicine, you said you did a fellowship?
First I did a residency, a pathology residency.
What does a residency mean?
So residency, so after you do a complete medical school, then you do additional training in a specialized field of medicine, in this case, the field of pathology. And
let me just stop you there before we go too far down. What is pathology?
So in general, pathology is the study of disease. So a pathologist will take pieces of tissue, biopsies, organs from surgeries. They can look at bodily fluids like blood, and they'll examine it both with the naked eye and under the microscope and give a diagnosis such as cancers or infections.
Okay. The field you were working in at that time, was it the broad area of pathology, or did you specialize in any subsets?
The residency program is just the broad field of pathology.
Okay. Following that residency program, and how long is that residency program?
4 years.
Okay. Takes a while to become a doctor.
Yes.
And then after the 4 years there, you moved on to where?
And then I did a 1-year forensic pathology fellowship at the Bexar County Medical Examiner's Office, also in San Antonio, Texas.
Okay. And so this is where you go from the broader pathology area to a subset, which is the forensic pathology.
Yes.
And what is forensic pathology in terms of the work you were doing when you were at the medical offices in San Antonio?
So forensic pathology is a subspecialty of pathology. So instead of just looking at a piece of tissue or blood, you examine the entire body, both on the outside and on the inside, to determine how the person died and determine the cause of death.
Okay. And that examination, when you say from the outside and the inside, that's basically an autopsy?
Yes.
Okay. And you look at the body from the outside to detect what injuries you see, and then you do a wide incision and look at the inside of the body to determine if there are any injuries to other parts of the inside.
Correct.
Okay. From that office in San Antonio, Texas, how long did you work there?
The fellowship program is a 1-year program.
Okay. And after completing the fellowship in Texas, where did you go?
After I completed the fellowship, then I began working at the Riverside County Coroner's Office.
Okay. And was that in 2014 when you were hired by Riverside?
Yes.
Okay. And you've been working there ever since 2014?
Yes.
In that time frame, Dr. Schuman, how many autopsies would you say have you conducted on behalf of the Riverside Coroner's Office?
In Riverside County, I would say approximately about 1,600 autopsies.
Okay. And when we're talking about those autopsies, these are not always autopsies of somebody who is deceased because of murder or a homicide.
Correct.
Okay. In fact, within your job, you would be looking at many different examples of a deceased body and the reason why.
Yes.
Okay. Would you do investigations into suicides?
Yes.
Or if, say, a baby died of SID, SID, sudden infant death syndrome, would you be looking at something like that?
Yes.
Okay. And also part of the job would be to look at decedents, people who are brought into the coroner's office who may have died from some sudden violent action.
Correct.
And is there a standardized procedure utilized in the Riverside Coroner's Office that each of the pathologists working there follow?
Yes.
Okay. And those protocols, how many other people are working with you in the coroner's office?
Currently, there are 4 forensic pathologists.
Okay. And then you have a chief forensic pathologist?
Yes.
Okay. When you follow the standardized protocols, just briefly explain what's happening to the body when it's brought into the coroner's office.
So when a body is brought into the office, first it is the body is weighed and measured, and blood samples are taken if possible. If needed, X-rays are performed. And then when the body is ready for autopsy, the forensic pathologist will first examine the outside of the body, looking for identifying features, scars, tattoos, hair color, eye color, and any injuries. And then on the internal examination, as you said, the wide incision is done, and the body is opened, and the organs are examined as they are first inside of the body. And looking for anything abnormal, injuries, natural disease, infections, cancers. And then each organ is removed and weighed and examined. And again, looking for anything abnormal.
Okay. And when that process is happening, do you have forensic technicians in the autopsy room taking photographs of the injuries to the body?
Yes.
Okay. And those photographs become part of the documentation and record of the public office of the coroner's office?
Yes.
Now, medical examiners in California are licensed physicians?
Yes.
Okay. And each of the pathologists working within the coroner's office in Riverside was a licensed physician?
Yes.
In addition to being a licensed physician, Dr. Schuman, do you hold any board certifications?
Yes.
And what board certifications do you hold?
I have 3 board certifications in anatomic pathology, clinical pathology, and forensic pathology.
Okay. And I know you said you're licensed as a medical doctor in the state of California?
Yes.
And also in Texas?
Correct.
Okay. Now, I'm going to ask you some questions regarding the case involving the decedents, Ricky Anderson, Barry Swanson, and Michael Martin. Are you familiar with those decedents who were autopsied in the coroner's office here in Riverside?
Yes.
You were not the one who conducted the autopsies?
That's correct.
Okay. Who conducted the autopsies?
Dr. Allison Hunt.
Okay. And she's a doctor hired by the Riverside County's office in the same way you were?
Yes.
Okay. And she has since left the Riverside employment and gone to work for another medical examiner's office in another state?
Yes.
Okay. Were you able to review the photographs that were taken as part of the documentation of these autopsies?
Yes.
And from reviewing those photographs, are you able to give yourself an independent expert opinion as to the cause of death of each of those decedents?
Yes.
Okay. Let me first start with Ricky Anderson. Let me show you what's been marked as exhibit number 4. And you see that?
Yes.
And what are we looking at?
This is the bag tag that was affixed to the body bag of Mr. Ricky Anderson.
Okay.
And check, Your Honor, move to strike this no foundation.
Okay. When bodies come into the coroner's office, how do they come in?
They arrive in a body bag with a bag tag affixed to the zipper.
Okay. And as part of that process, are they then photographed in terms of the record of the coroner's office?
Yes.
Okay. So each autopsy will have a photograph of the bag tag showing that the body's coming into the coroner's office.
Yes.
Okay. And part of the reviewing process that you did when you looked at these photographs, you saw this photograph of Mr. Ricky Anderson's bag tag.
Yes.
Thank you. Now, let's look at some of the other photographs that you reviewed in terms of the injuries to Mr. Anderson. Showing you People's 163. You see that photograph there?
Yes.
Are you familiar with that photograph?
Yes.
And what are we looking at there, Dr. Schuman?
So this is the back of the left side of the head and behind the left ear. And what we can see is that there is areas of contusion or bruising and abrasions or scrapes of the skin, as well as some hemorrhage behind the back of the ear.
Okay, when you say hemorrhage, what do you mean by hemorrhage?
Well, this could be one of two things. It could be a contusion or a bruise caused by a blunt impact injury, or it could also be what's known as a battle sign, which is when there's a fracture on the base of the skull and then blood is able to seep through the fracture into the tissues, and you'll see it collecting behind the ear.
But this injury, looking at the photograph, would be consistent with blunt impact force.
In this, around here, yes. In this, it may be also,
okay.
Or it could be the battle sign.
Okay, so to above the area on the back of the head, above the left ear, that's blunt force trauma there.
Yes.
Okay, thank you. Showing you 14 for identification. You recognize that photograph?
Yes.
What are we seeing with that photograph there?
This is a photograph of Mr. Anderson's face. And up here on the right forehead is a laceration or tearing of the skin. Around the eyes there are more collections of hemorrhage, known as the raccoon sign. Again, with fractures to the base of the skull right behind the eyes, then the blood is able to seep through, and you can see the bleeding in the tissue surrounding the eyes.
And let me show you People's 15 for identification. And is that photograph a close-up of the blunt force injury to the left side of the forehead?
This is the right side of the forehead.
Oh, okay.
Yes, it closed up.
And that would be consistent with a blunt force injury impact?
Yes.
And then let me show you 16 for identification. And do you recognize that photograph, Dr. Schuman?
Yes.
And what are we looking at there?
This is a photograph of the left side of the head, and there's a large area of contusion or bruise involving the cheek, the ear, the front of the ear, and the left side of the neck.
Okay. As we're talking about the left side of the neck, let me show you, it's been marked as People's 5 identification. And do you recognize that?
Yes.
What are we looking at?
So this is a photograph of the neck structures. They're removed and blockered together. So it starts with the tongue, and then it moves down to the larynx or windpipe, trachea, esophagus, and the aorta. And in this photograph, there is some contusion here at the very back of the left side of the tongue.
Okay. And I'm showing you people 6 for identification. And what are we looking at there?
This is a photograph of the hyoid bone. It's, as you can see, it's a horseshoe-shaped bone. It's located between the chin and the thyroid cartilage, or where the Adam's apple would be, right here. And in this photograph, there is a fracture here on the left side.
Okay, so when we saw that photograph a moment ago, showing you 16 again, would that be the cartilage would be on the left side, the hyoid bone?
Yes.
Okay, consistent with the force we see there on the left side of Mr. Anderson's face.
Yes.
Now showing you what's been marked as people 17 for identification. You see that photograph there?
Yes.
And does that appear to be a photograph of Mr. Anderson from the back of his head?
Yes.
Okay. And there, I mean, how many areas can you see that indicate blunt force trauma to you?
In this photograph, again, we can see the contusion here on the left side of the face and neck and ear. There's, which also extends here, back behind the ear. Up here, there's an area of abrasion and contusion in the back of the left upper head.
Okay. And that's, those injuries are in addition to the injury we saw on the front of the forehead?
Yes.
Now, you said earlier that when you do an autopsy, you begin by looking at the outside of the body, and then once that process is done, then you look inside the body.
Correct.
Okay. And from the photographs that you saw with respect to Mr. Mr. Anderson, sorry, there were photographs taken of the inside of the body.
Yes.
Okay. Let me show you what's been marked as 13 for identification. And do you see that photograph?
Yes.
Okay. Can you tell us what we're looking at there?
This is a photograph of the skull after the scalp has been reflected or peeled off of it. So this, the face would be over on this side, and the back of the head is over on this side. Okay. The right side is over here on the top of the photograph, and the left is here on the bottom. And what I'm seeing is there's hemorrhage on the underside of the scalp, diffuse hemorrhage. That's called subgaleal hemorrhage. And also a number of fractures. There's a fracture here across the frontal bone of the skull, and a fracture here along the back of the head across the parietal bone.
Okay. And that fracture on the parietal bone goes from one side to the other?
Yes.
Okay. And would that be consistent with blunt force trauma?
Yes.
Okay. And then let me show you 10 for identification. You see that photograph?
Yes.
Is that the correct way to orientate the photograph?
I was going to ask if you could flip it
Sure.
180. Oh, that works too.
Does that work?
Yes.
Okay. What are we looking at there?
This is the left side of the head. And skull, again, the scalp has been reflected forward and backward, and you can see the hemorrhage on the underside of the scalp, as well as multiple linear fractures involving the frontal bone, temporal bone, parietal bone, and occipital bone in the very back of the head.
Okay. So how many fractures are we looking at there?
It's hard to tell. There's a lot of smaller fractures down here.
Well, let me ask you another way. So I've been looking at that. There are several areas of fractures to the head of Mr. Anderson.
Yes.
Okay. And then when the head is hit with a great deal of force, are there other, apart from major fractures, are there other smaller fractures to the skull?
Yes.
Okay. And in this case, we have the major fractures, and then you have smaller fractures?
Yes.
Okay. Do those fractures kind of permeate from the initial breaks, or explain that?
Yes. So it appears that the area of impact is approximately here, and then there's what we call radiating linear fractures that extend outward from the impact.
Okay.
You're indicating approximately the middle of the photograph.
Yes.
And looking at the skull, that would be on the left side of Mr. Anderson's skull.
Yes.
Okay. And showing you 12 for identification. And you tell me, Dr. Schuman, which way you would like to see the photograph. Is that okay?
Yes, that's fine.
What does that photograph show?
This is a photograph. Okay, so the left side is up here on the top of the photograph. The right side is on the bottom of the photograph. This is the back of the head. And this is showing the fracture that's extending across the parietal bones.
Okay. And showed you 11 for identification. Is that fine, or should I rotate it?
Yeah, rotate it. One more time. Okay. Okay, I think that's good.
Are you oriented?
Yes. Okay.
What are we looking at there, Dr. Schuman?
Let me make sure. Okay, this is the left side of the skull. Here's the left ear down here.
Showing the left side of the photograph?
Yes.
Okay.
Left lower part of the photograph. Showing, again, numerous fractures of all the bones of the skull.
Okay. And looking at this now, I mean, the process by which this is done is the face is, in essence, just peeled back from the bony structure of the skull.
The scalp is peeled forward, covering the face.
Okay. So the scalp from which protects the skull is then brought down over the face.
Yes.
Okay. Now, we've kind of gone from the outside of the body to the inside of the body. Now, to determine the nature and severity of those injuries, do you, and is it the standard practice of autopsies, then take out the brain and look inside the inside of the skull?
Yes.
Okay. I'm going to show you what's been marked as 7 for identification. And do you see that photograph there?
Yes.
Explain to us what we're looking at, Dr. Schuman.
So, so during the autopsy, the top of the scalp that we were just looking at is removed with a saw. And then underneath, we would see the brain. And then once the brain is removed, we can see the base of the skull here. And then this is the top of the skull that has been removed. And then these are fragmented pieces of bone that were fractured, that came apart during the removal of the top of the skull.
Those fragments, that's uncommon in autopsies when you're just removing the brain.
Correct.
Okay. So the indication of the multiple fragments show that the skull was hit with such force that those fractures made the head or the skull just kind of crack into different pieces.
Correct.
Okay. And if we can just show a close-up of that, and that's people's 9 for identification. And is that a close-up of the fragments of the skull that broke off when the autopsy was performed?
Yes.
Okay. And I think earlier we saw the inside of the skull once the brain had been removed. I'm going to show you people's 8 for identification. And you see that there?
Yes.
Okay. And do you recognize it?
Yes.
Okay. What are we looking at, Dr. Schuman?
Actually, can we rotate it?
Sure.
To, one more time. Okay, thank you. Okay, so after the brain is removed, this is the base of the skull. So there are 3 main components of the base of the skull. There's the anterior, middle, and posterior basilar skull. And there are multiple fractures, and you can see hemorrhage as well on the anterior and the middle basilar skull.
Okay.
Anterior is to the top and posterior.
Yes.
Thank you, Ralph. Now, in terms of the injuries to Mr. Anderson, they all appear to be to the head area.
Yes.
Okay. Basically above the neck and above.
Yes.
Okay. Did you, from your review of the photographs, see any injuries that you would term as defensive injuries?
No.
Okay. Defensive injuries being something where if a person was being struck with a blunt force instrument, they tried to protect themselves by raising their arms.
Correct.
Okay. It's common. Well, would you expect to see something of that nature if somebody was struck with a blunt force instrument and they would have injuries to their arms?
Depends on the case. Yeah.
It depends on the circumstances, but in this case, in your review, there were no injuries that you would term defensive to Mr. Anderson's arms.
Correct.
Okay. Now, in terms of your independent review of the photographs in this case, do you have an opinion as to the cause of death for Mr. Ricky Anderson?
Yes.
Okay, and what would that be?
My independent review, I would give the cause of death as multiple blunt force head injuries. Okay,
thank you. Now, in terms of the photographs in this case, did you also look at some 3D models?
Yes. Show you what's been marked as 244 for identification, and showing you this 3D model from a distance, which is required in COVID times. You recognize the model? Yes. Okay. I'm going to show you on the Elmo. And looking at the injuries there,
would you say the model fairly represents and is accurate to show the injuries that you saw in the photographs?
Yes.
And on the side of the head there, of the 3D model, do those fractures that are indicated accurately reflect, from your point of view, what you saw on the photographs of Mr. Ricky Anderson's autopsy?
Yes.
And then looking at the back of the skull, those fractures and indentations, which you can see here in 3D form, right there where my thumb is, does that accurately reflect the injuries to Mr. Ricky Anderson that you saw in the photographs?
Yes.
Thank you.
Great. All right, ladies and gentlemen, we'll take our morning recess at this time. Might all be on to discuss the facts of this case.